Welcome back. So we are on theory dozen. Indication. In which conditions can we give these typical antipsychotics? Primarily, they are indicated in schizophrenia and other psychotic disorders. What are those other psychotic disorders? We have brief psychosis, schizophrenic disorder, schizoaffective disorder, delusional disorder, drug-induced psychosis, HIV-induced psychosis. Yes, but they can also be given in mania due to bipolar disorders. They can also they can also be given in anxiety. So, mode of action. People, it is very important to understand the mechanisms of action because we can't just be giving medications. That's why if you don't understand the mode of action, you may end up overdosing the patient. It is very important to understand these medications. Whether a clinician, whether a doctor, whether a nurse, it is very important because these medications are associated with movement disorders, aka extrapyramidal symptoms. From there, let us look at the mode of action. What is the mechanism of action for them to relieve psychotic symptoms? So now, I'm going to tell you 4 major pathways in the brain in relation to dopamine. That's when you can understand the mode of action of these medications. That's when you can understand to say, when you are prescribing these medications, higher doses, it is very harmful to the patient. Sometimes you might cause a permanent damage. So now, there is a pathway in the brain, and they call it the mesolimbic pathway. So this pathway, it is associated with positive symptoms such as delusions and hallucinations. According to the dopamine theory, how do they come about? They come about as a result of hyperactivity of dopamine in this pathway, causing delusions and hallucinations in the postsynapse neurons. And remember, the mesolimbic pathway, it is located from ventral segmental area to nuclear accumbens. So I've said the mesolimbic pathway, it is associated with the excessive amount of dopamine, resulting into delusions and hallucinations. But when a person comes to the hospital, it's not a must that they can come with the positive symptoms. A patient can also come with negative symptoms. So the negative symptoms, they come as a result of dysfunctional of the mesocortical pathway, resulting into negative symptoms of psychosis such as avolition, flat affect, anhedonia, asociality, ambivalence. You can mention many. So when these medications are given, the main target, it is to regulate the amount of dopamine in the mesolimbic pathway by blocking dopamine 2 receptors in the postsynapse neurons. But in the process, they can as well tamper with the amount of dopamine in another pathway which is responsible for coordination and movement. And this pathway is called the negrostriatal pathway. So the side effects, especially the extrapyramidal side effects, they come as a result of a reduced amount reduced amount of dopamine in the negrostriatal pathway because of dopamine 2 receptors blockage. Understand, yeah? So also when they are given to women, they can also cause the hormonal imbalance. In women, they can cause amenorrhea, and in men, they can cause the gynecomastia, which is the enlargement of the breast in men. So these drugs, they can also tamper with the hormones, especially prolactin. So what happens in the tuberoinfundibular pathway? When there will be reduced amount of dopamine, there will be increased amount of prolactin, causing amenorrhea in women and causing gynecomastia in men. So now, when they're asking you to say, what is the mode of action of the typical antipsychotics? The mode of action is that they regulate the high amount of dopamine in the mesolimbic pathway by blocking dopamine 2 receptors. We have talked about the indication, also the mode of action. Now, let's talk about the side effects. Those people who are working in the hospital, when you are prescribing these medications, these medications, they can be given in higher doses, but for a short period of time. But these medications, according to World Health Organization, they are supposed to be given in lower doses because they have got the possibilities of inducing movement disorders, aka extrapyramidal symptoms. So now, the side effects are divided into general side effects and the specific side effects. What are some of these general side effects? One, sedation. So these drugs are highly sedative, and the sedation comes as a result of alpha receptors blockage. They can also cause orthostatic hypotension or postural hypotension. In case you want to understand this, postural or orthostatic hypotension, it is a type of low BP which is associated with position. Then they can also cause weight gain because they tamper with the histamine receptors. Then they can also cause dry mouth because they can also affect muscarinic receptors, resulting into dry mouth. So those are some of what we call general side effects. The dizziness sometimes comes as a result of alpha receptors blockage, resulting into hypotension causing dizziness. Are we there? So now, let us look at what are these specific extrapyramidal symptoms. They are also known as the movement disorders. Student, they will call you to say, they will ask you to say, the antipsychotic medications can cause a major reaction. This major reaction is called, the answer here is the extrapyramidal reaction or extrapyramidal side effects. And there are 5 the main ones. So these extrapyramidal symptoms, as I told you in the first place, that they come because of dysfunctional of the nigrostriatal pathway, and there are 5. Sometimes these side effects can develop in a patient within hours after drug administration, sometimes within days, within weeks, within months, and also within years. And those side effects which develop after years, they are irreversible. That means when you are putting a patient on higher doses of typical antipsychotics, there is a possibility that you can cause a permanent damage, especially when they are given for a longer period of time. So the first extrapyramidal side effects which can develop in a patient, it is acute dystonia. So the acute dystonia is characterized by spasms of the muscles of the neck, where the neck can bend in a locked position. Also, it can affect the muscles of the tongue, where the tongue can protrude. And it also can affect the muscles of the eyes, where there is abnormal eye deviation. We call it oculogyral crisis. And they can also affect the muscles of the face, where there is unnecessary facial movement.